So we're going to go ahead and get the interview ready for her, and it's going to be a nice little chat. And we're here on Consumer Choice Radio on the Big Talker 106.7 FM, broadcasting out of Wilmington, North Carolina. And we thought, since we broadcast on these airwaves, we might as well highlight one of the great hosts that's also on the station, but someone who's doing great, amazing, positive work throughout the community. We have Sara Auld on the program. She is the founder and executive director of Health Possible, a nonprofit that focuses on increasing the societal value of personal and community health, both in Wilmington and across the country. She's also host of the Sara Auld Show here on the Big Talker, Fridays at 6 p.m., and you can catch that on the podcast version. Most of the topics that she covers, we've got health and wellness, time management, leadership, much more. Sara is awesome because she's focusing on the positive. So Sara, thanks so much for coming to Consumer Choice Radio.
Thank you so much, Consumer Choice Radio, for having me today. This is very exciting to be with you guys.
Well, great to have you here. And, we were able to meet in person there in Wilmington in the studio last week, and thought it'd be great to get you on the show and to introduce you a little bit to our listeners so they can understand the work that you're doing. We've had many people from nonprofits on in the past, but you're one who focuses more on positive things and health and wellness. What would that have to do with consumer choice? Some might ask, but I think if people listen to your program, they'll see that there's so many aspects of our daily lives that are churning us in and out, and you kind of focus on a positive way that we can deal with that and actually empower people. So talk to us a little bit about that.
Yes, so specifically talking on consumer choices, so something that we do at Health Possible is care coordination. So people apply with us for financial aid, and that can be for a scholarship to get wellness health care. That can also be for a no interest loan. And in doing the financial aid aspect, we also send them to places of their choice. So from personal trainers to registered dietitians to mental health counselors, and we align them with the professionals who really focus on their specific need. And through that, we give them a set amount of hours per month that they attend care. And we truly turn their life around through doing this. But of course, is there a choice to be there, right? They're motivated, they want to make a difference. They might be in the lowest low of their life, and they're trying to come out of it. They're dedicated to having a better quality and quantity of life. So that's our goal at Health Possible.
And what does that look like? What does that look like given everything that's going on? I know a lot of people have speculated about the kind of unseen cost of COVID-19. Obviously, that's not to downplay the kind of tragic nature of the pandemic and the lives lost there, but some people have started to talk about the mental health impact, the overall health impact of things like lockdowns and people being at home and not being able to see family or do other things. How is that impacting what you're seeing in terms of when you're working with people and connecting with them?
Yeah, so it really impacted, of course, the social aspect, right? So we as humans, we're meant to be healthy and positive in communities, right? So when you take that community aspect away, you've kind of taken away the entire core of our business, which is setting people up with the right people around them who help them reach positive goals, kind of getting rid of these toxic parts of their life. So it did harm us in removing the social aspect. And it was pretty wild, actually. Our costs went through the roof for mental health. That was another biggest thing that we did notice. We had already had 6 active clients at the time on scholarships. And I want to say, if I remember correctly, 5 of which are on full rides. Another one not on a full ride, but regardless, the costs that we were distributing before the pandemic were pretty even between fitness, nutrition, and actually mental health was the lightest cost that we had before the pandemic. Once the pandemic hit and we got about a month and a half into it, all of a sudden it was like every single person almost needed a mental health counselor, or at least if it was a few people that needed one, they needed one much more often than they did prior. Mental health also happens to be one of the most expensive forms of wellness healthcare that we see. So definitely drove the cost up for that. And I think a lot of that has to do with the removal of that social aspect I touched on.
Yeah, we can't get together at restaurants anymore. We're limited in how many people can kind of go out in public. I mean, everyone's got to wear a mask. Definitely trying. In terms of your own backgrounds, what sort of led you to this kind of new entrepreneurial journey? Because you're on the radio here on the Big Talker, you have that in podcast form. But sort of, what is your own story and why you're interested in this stuff?
Yeah, it's so hard to make that short and sweet. Honestly, I'm sure every entrepreneur thinks and says that, but it's kind of like founders. I'm sure you guys have heard this before in the founding world, but founders create in their life kind of an antidote for their own background and their own history, right? So when I grew up, I had my first cash flow job when I was 12 years old, and I worked my entire life, of course, to this day. I've had more cash flow jobs today than years I've been alive. I'm 27 years old right now. And that's not from being fired. That's not from, not being comfortable. It's just from constantly having to do whatever was possible to make ends meet in my life. My family did experience the 2008 recession in the worst way. We did go bankrupt. Well, I guess not the worst. We were still eating and had a mattress, right? But my family did experience bankruptcy at that time. And through that, I watched my parents kind of give up their entire livelihood. My dad spent his 20s and 30s a marathon runner. My mom loved to garden, always fed us meals of fresh vegetables from outside. And then working, 16, 20 hours a day, both of them taking care of our family. My dad became this sedentary truck driver. I just watched them give up their whole life, and it really hit home for me to try to contribute and help a contributing member of society. My parents never took on, of course, the bankruptcy is not the best, thing to utilize in comparison to this, but they did not take on government assistance. And as a child, that's all I really noticed. And that I really admired that from them. And I felt that, if my family can pull together and do this and make this happen, keep food in the fridge and, keep our house over our head, then I can make sure other people, don't lose out on their marathon running, the things they enjoy, the things that keep them mentally well. There was so much more that came with that, on site back then than just being broke, the hardship. So I really wanted to give that back. I never wanted to see anybody go through what my parents went through again. And I truly believe that when people are in hard times, if you just take care of yourself, if you put yourself first for a little while, you're much better equipped to take care of the rest of the people around you. That includes your whole community from an economic standpoint. So that's kind of my background and where I come from and where the initial thought process of Health Possible came from. It was after that I became a personal trainer and wanted to focus much more on, people who couldn't afford the service. And that kind of gave me the detail of the model of the business. Already had a passion to give back, given my family background, and then becoming a personal trainer, focusing on people who couldn't afford personal training, knowing it was really like a life coaching lesson for a lot of these people and was so life-changing for them. We developed the concept of fundraising for fitness, nutrition, mental health care, combining them. And that's really the only way that we could pursue this kind of thing. Health insurance doesn't cover these things a lot of the time. So it's kind of a whole mix.
So what's interesting about the fitness side of things is that in many ways, if we look at healthcare more broadly, it's the most important proactive step one can take. And I think the biggest criticism of the healthcare system in the United States is that it's very reactive. It's very, I have this problem, therefore I need to go to the doctor or what have you. And so I think that the fitness side of things is very important, especially for people who don't think that they can afford it. On the life coaching side of things, walk us through what that looks like, the type of people whom you're traditionally working with. Are they people who've never been active before and never really approached fitness from kind of a proactive perspective? Or are they people who have maybe lost their way as they got busy with a career? How does that look like?
Yeah, it's different for everybody. One of our really big core values at Health Possible is that we meet people where they are, right? No one's coming to us with the same starting block and no one has the same end goal either, right? And the really cool part, I think people sometimes even make a face a little bit when I tell them, the number of clients that we've had over a few years. It seems pretty small, at a glance, but the things we do for those individual people are very extreme and very large. And it takes a lot of focus to focus on one person at what we do. So So when people come to us, they may have never attempted in their life before. A lot of them, may have a problem where they're at highs and lows, and we're trying to get them to a medium ground forevermore, habitual change, right? So we'll have people like, we had one client who was sober from being an addict for years and years, and we're trying to find that person the medium even still, and now he is an amazing runner. He just ran a 20K for the first time in his life. The man's down 50 pounds. He's in his 50s, right? And his goal is actually to now become a personal trainer and train other people. So the give back is kind of the end goal for him, and so many of these people. We have another woman who is a single mom, came to us a previous basketball athlete. She grew up an athlete. I visited her new home recently. She had pictures on the wall of her playing basketball at a high school here in town, and she was so fit. And she came to us with a goal to lose probably close to 50 plus pounds. She's down 25 and a little over 25, and she was on government assistance, living in government housing, working at the Boys and Girls Club, just essentially to ensure her daughter could eat and be taken care of every day. Grow a little confidence. People might look at it as just taking weight off the person sometimes, but really, we made this person so confident. She walked away from her part-time job, went and got a full-time job with New Hanover County, keeping kids out of juvenile hall, disqualified for food stamps, sends me pictures of her extravagant meals every night, and she just bought her first apartment last week and moved out of project housing. So we're so proud of her too, right? And these people's goals, again, look different all the time. They may come from her background, fit in high school, hit a low point in life, something tragic happens, or it could be something they've been dealing with forever. It's really never the same story, which is also what's so cool and marketable about it.
I think one aspect that, we're mostly discussing regulations and policy on this program affecting consumers. And one thing that we always notice is that, we do have a big narrative on self-reliance and independence. But, this is one that's fairly unique to the United States. You don't really have these kind of community programs necessarily that will be privately funded in other countries. And you don't see this kind of level of charity necessarily. We hear it all the time, every time there's a tsunami or some hurricane in some country very far away, and the number of Americans will bound together and donate to, who knows, the Red Cross or whatever organization is always astounding. And you don't really see that in many other countries. And still, there's a lot more need for that in the United States. Could you tell us about this aspect of sort of, there's certain aspects that government regulation will try to fix or try to structure, but what about those cracks of people who can't be reached, or, people who might be in between particular positions?
Yeah, it's unfortunate, because a lot of the times I think, and I truly believe, nonprofits will they will find themselves trying to do what they believe the government should have done for people. That's often why nonprofits open. They think the government is lacking and they need to do something in place of that. And really, what a nonprofit is for, in my opinion, is that we are, community focused on the place that we're at, providing some kind of quality care. And I think we actually do a disservice to our communities when there's not mass education behind it, right? So there's these gaps and people hard to reach. And those are the people we as nonprofits, of course, hope to find. And at the same time, we don't want them living off government assistance. We don't want them dependent on us forever. There's so many negative things about our system that make it too easy to stay on that assistance. It's too comfortable, I had a very direct section of my show, I want to say just a few weeks ago on my podcast, and I said, honest question, crazy talk. Is it crazy to think that people receiving straight checks from, whether it's welfare or so forth, should they be doing community service in exchange for these finances? Having to do some kind of thing that maybe keeps people off the street in a impoverished, maybe more violent area, or teaches them new skills, gives them more positive social circles, takes some burden off of our tax dollars and community in exchange for them receiving, again, those tax dollars and money from the working people. There's a lot of aspects to this question. It's really hard for me to even narrow in on one part, but I really think that as a nonprofit in a small community, we're here to deliver quality care. I'm personally not here to do a job I thought the government was supposed to do. I'm actually trying to remove people from government assistance in the long haul and make sure that we need less and less of that moving forward, and that starts in the home. So we find those people, we start in the home. Again, I don't think it's something, our government can do all by itself. People love right now to say, it shouldn't be a cop's job to do the social work, the mental health work, the cop work, all these things. There's a little aspect of that that's true to every area in every position. How many things can you do? And for me, I find my job, my purpose to be finding these people and doing this one thing that keeps them off our system. And that's what we as our nonprofit are doing. We're not a hand out, we're a hand up. That's how I see it.
And what's it like when people kind of break free of that dependency trap in terms of the clients you're working with? What's their perspective on it?
Oh, they love it. And they're so confident. It's so cool to see. And I tweeted this the other day. It is amazing to me. It really comes down to, you would not believe how many people in life just simply needed somebody, or still do need somebody to believe in them, period. How many people in this world, don't get some kind of attention that they cared about the most. And I mean, people come in my office and I just tell them that they can do it and they're going to do it, and I'm really on their team. And they're so shocked, like no one's ever said that to them before. And just the glow that comes to their face, like they just came to life for the first time in 10 years. It's like, has nobody ever just patted you on the back and said you already made it this far? I mean, it's only up from here. Like, you walked into the right office. And the confidence that comes off of becoming less dependent, they don't want to be. Not all of them even know they don't want to be. Another really hard conversation that we have, I don't think I'm brutally honest. I think I'm just really direct, and I'm compassionate at the same time. I sit people down and I say, what if I told you that being on government assistance, and inclusively now getting financial aid from Health Possible, which we want to give to you, but we want you to earn it, right? But what if I told you that takes away your control of your life, right? Let's put that in perspective. And they're kind of like, what do you mean? Like, I'm in control of my life, and I do a little education of, no, you're not. Your food is dictated by this stamp. Where you live is dictated by this rent. What you do is dictated by all of these things that you can take control back over, and you're about to, because you're in my office, and we're going to make sure you don't need it anymore. But all of a sudden you have choice in life. Every time you become dependent on these things, you give up choice. So let's get you off and give that back to you. Don't you want to choose what you buy at the grocery store every day? And they're kind of like never thought about it that in depth. And that's a really big, like, gunshot start of the track, let's go kind of moment for them. And it's a hard conversation for me to have. It never gets easier, but I do have it almost every single time, because I'm there to let them know Health Possible is not your financial aid forever. It's just your financial aid for right now. What are you going to do with it?
We're speaking with Sara Auld. By the way, sorry to cut you off. You can follow her on Twitter at Sara Auld, AULD. Sara, let us know about your other projects or plans, and also how we can find out more about Health Possible and kind of other ways that our community can engage with you.
Awesome. Thank you guys so much. Do you want me to tell you right now?
Oh, yeah. Go ahead. Hit us with your best shot.
Okay. Healthpossibleinc.org is our website. You can call us or text us at 910-800-0287. My name is Sara Auld. You can find us on all social media handles, Health Possible Inc. or HPI.org. Follow us on Instagram, Twitter, Facebook, LinkedIn. You can follow me as well.
Wonderful. Okay. And definitely we'll direct that. We'll link to that in all of our show notes and everything else. Sara, it was great having you on. Obviously a big talker personality throughout the week. You can catch her show Fridays at 6 here on the Big Talker 106.7 FM. David, I think Sara gave us something to really think about here for the future, huh?
Yeah. Thank you again for joining us. Some great perspective for our listeners. Yaël and I spend a lot of time complaining about government policy and regulations and all of these things. So it's nice to talk to someone who's out there actually making that difference in the community. So obviously, thank you for that. Thank you for joining us on the program today.
Thank you so much, Yaël and David. I appreciate you guys.